I regret that our Democratic friends made clear early on that they did not want to work with us in a serious bipartisan way to address the Obamacare status quo. But Republicans believe we have a responsibility to act, and we are. We agreed on the need to free Americans from Obamacare's mandates, and policies contained in the discussion draft will repeal the individual mandate so Americans are no longer forced to buy insurance they don't need or can't afford. We'll repeal the employer mandate so Americans no longer see their hours and take-home pay cut by employers because of it. We agreed on the need to improve the affordability of health insurance, and policies contained in the discussion draft will do that. We also agree on the need to strengthen Medicaid, preserve access to care for patients with pre-existing conditions, and allow children to stay on their parents' health insurance through the age of 26. I'm pleased that we were able to arrive at a draft that incorporates input from so many different members who represent so many different constituents who are facing so many different challenges. The draft containing the solutions I mentioned, along with many others, is posted online, and I encourage everyone to carefully review it.
This bill will result in higher costs, less care, and millions of Americans will lose their health insurance, particularly through Medicaid. It's every bit as bad as the House bill. In some ways, it's even worse. The President said the Senate bill needed heart. The way this bill cuts health care is heartless. The President said the House bill was mean. The Senate bill may be meaner. The Senate Republican health care bill is a wolf in sheep's clothing, and we're potentially voting on it in a week. No committee hearings, no amendments in committee, no debate on the floor, save for 10 measly hours on one of the most important bills we're dealing with in decades. That brings shame on this body.